Right now in New York City, hospitals are running without thousands of nurses. Nearly 15,000 nurses have walked off the job in the biggest nurses' strike the city has ever seen. It started early Monday morning across three major hospitals: Mount Sinai, Montefiore, and NewYork-Presbyterian. So what happened, and why does this matter for beyond New York? Let's break it down. For months, nurses had been negotiating new contracts with the hospital management. Their union says talks went nowhere. Nurses are demanding three things: safer staffing levels for patients, protection from violence at work, healthcare benefits for themselves. Yes, healthcare benefits for healthcare workers. The union says some hospitals threaten to cut or scale back nurses' medical coverage. It also says management wants to weaken rules on how many patients each nurse can safely handle. Hospital executives deny wrongdoing and say they have offered pay raises. NewYork-Presbyterian says it proposed wage increases and one-time payments of $4,500 per nurse. But nurses say that doesn't solve the bigger problems. In 2021, after the COVID crisis overwhelmed hospitals, New York passed a law requiring safe nurse-to-patient ratios, especially intensive care units. In 2023, nurses went on strike and forced hospitals to apply these standards across all departments. Now the union says hospitals are quietly walking them back. Many nurses say they are stretched too thin, caring for too many patients at once, increasing the risk of mistakes and burnout. As one activist at the picket line put it, COVID broke the system, and nurses never really got a break. Safety is another major concern. Nurses want stronger protection after a series of violent incidents, including an active shooter case at Mount Sinai and a deadly shooting at NewYork-Presbyterian Hospital in Brooklyn just last week. Union leaders say they've asked for measures like metal detectors and more security staff. So far, they say hospitals have not agreed. The strike is also drawing attention because these hospitals are not struggling financially. According to public records, NewYork-Presbyterian made over $500 million in profit last year. Montefiore nearly $290 million. Mount Sinai reportedly more than $100 million. This is why many nurses say this is not about money being unavailable. It is about priority. As one lawmaker on the picket line said, it is hard to accept that people who provide healthcare have to fight to keep their own. The strike comes during one of the worst flu seasons New York has ever seen in years. In December, almost 1 in 10 emergency room visits were the flu. Even now, hospitals are under heavy pressure. Health experts say this gives nurses leverage because demand for care is high and staff shortages hurt patients immediately. Public support also remains strong, especially after what nurses went through during the pandemic. The strike is now a major political test. New York Governor Kathy Hochul is facing re-election and says her priority is protecting patients while reaching a fair deal. The New York City Mayor, Zohran Mamdani, has openly backed the nurses. He joined picketers outside a Manhattan hospital and said nurses' value is not negotiable. For him, this is one of the first big challenges of his leadership. Negotiations are still technically open, but there is no agreement yet. Hospitals are running on temporary staff. Nurses say they are prepared to stay out for as long as it takes. For New Yorkers, this is about whether hospitals can stay safe and functional. For the rest of the world, it is a reminder that even one of the richest cities on earth, healthcare workers are still fighting for basic protections. And for now, the city waits to see who blinks first. For more such explainers, subscribe to Dawn News English.